All right. Welcome in, everyone. You're with us for another deep dive. And today we're taking on something that I think a lot of people have some experience with, and that is acne.
Oh, yeah.
Whether you've dealt with it personally or you know someone who has, it seems like it's just one of those things that's kind of ubiquitous. So we've got a ton of information here from our sources, and we're going to really dig into what it is, and more importantly, maybe separate some fact from fiction.
Absolutely. I think there's a lot of misinformation out there
Oh, yeah.
about acne. So really, the mission here is to just equip everybody with a real understanding of what's going on so they can better manage it, throughout their lives.
Yeah, and avoid those common pitfalls. So let's just jump right in. When we talk about acne, what are we actually talking about? Because it seems pretty straightforward, but our sources indicate it's, a little bit more nuanced than just the occasional zit.
Right. So medically speaking, it's called acne vulgaris. And it's actually incredibly common. I was really surprised to learn that it affects, 40 to 50 million people in the US alone.
Wow.
And like 85% of people will experience acne at some point in their lives. And one of the things I think is really important to underscore is it's not just a teenager thing.
Right.
Adult acne is a very real phenomenon, and it can affect people in their 30s, 40s, 50s. So if there's anybody out there listening who's, maybe past their teenage years and still struggling with acne, you're really not alone in that.
Yeah, so it really can affect
Okay.
people at any stage of life. And it appears in a lot of different forms,
Yeah.
too. It's not just kind of the classic pimple.
Exactly. So, I mean, you have your classic pimple, but acne can also show up as, deeper lumps, sometimes painful cysts under the skin, hard bumps that are called nodules, and then, of course, the plugged pores, which are, your whiteheads and your blackheads.
Right, right. And it's not always just on the face, which I think is what a lot of people associate it with.
Yeah, I mean, the face is a very common place for acne to appear, but it can also frequently occur on the neck, the back, the shoulders, even the upper arms.
Okay, so we have kind of a picture of what it is and where it tends to show up.
Uh-huh.
But what is actually causing this? Like what's going on underneath the skin?
So it's really a combination of factors that lead to those, eruptions that we see on the skin. And our sources kind of highlight three key things that are happening.
No.
The first is that you're having an overproduction of oil by enlarged oil glands in the skin. And then the hair follicles that normally release this oil get blocked. And then within those blocked follicles, bacteria start to grow. So you have this kind of perfect storm happening, too much oil, nowhere for it to go. And then this bacteria feeding off of that and thriving in that environment.
Yeah, it's like they're having a party in there, right? Like too much oil, everyone come on in.
Exactly, exactly.
All right, so, but there are other things too that can kind of contribute to this whole process.
Right. There are all these, what I guess we would call exacerbating factors, things that can make it worse.
Okay.
So stress is a big one. If you think about it, stress hormones can really influence oil production. The accumulation of dead skin cells can also contribute to these blockages in the pores. And then even an allergic reaction to the bacteria that naturally lives in our pores can kind of trigger inflammation. And then there are things like excessive scratching. There are certain medications that can cause acne. And then, of course, there's anabolic steroids, which can also lead to breakouts.
So I feel like we talk about genetics in just about every episode. So does genetics play a role here too?
Definitely. Genetics and hormonal changes are also significant factors in who gets acne and the severity of it. So if your parents had acne or your grandparents had acne, you are more likely to also have acne.
Okay.
And it kind of, you can think about your genes kind of setting the stage for how much oil your skin produces, how it responds to inflammation.
Right.
So you might be more predisposed to acne, but not necessarily destined for it.
Right.
And then, of course, hormonal fluctuations. So, we think about puberty, obviously a huge time for hormonal shifts, and that can really trigger acne. But also menstrual cycles, pregnancy, and even menopause can cause these hormonal fluctuations that can lead to breakouts. So it's all kind of interconnected.
Yeah. So it's kind of a lot of different things that are coming together to make this happen. So the sources went into some detail about the different types of acne.
Yeah.
So maybe let's break those down so it's a little bit clearer, what we're actually seeing. So let's start with maybe the milder forms of acne.
Okay. So we'll start with whiteheads.
Okay.
Whiteheads are those, small white spots that you see on the surface of the skin. And they happen when a pore gets completely blocked off. So the oil, the dead skin cells, the bacteria, it's all trapped inside. But the good news is that they tend to heal relatively quickly.
Okay. All right, and then we've got blackheads, and these are the ones that I think people often mistake for just dirt that's trapped in their pores.
Right, exactly. And they appear as dark spots on the skin, and the pore isn't completely blocked in the case of a blackhead.
Oh, okay.
So it's still partially open to the surface.
Got it.
And basically what happens is that that mix of oil, bacteria, dead skin cells makes its way to the surface. And then when it's exposed to air, it undergoes this process called oxidation, which turns it brown or black. So that's why they have that color.
Okay.
But yeah, it's not dirt.
Okay, that's good to know.
And you can't just wash it away.
Okay.
Unfortunately, they often take longer to resolve than whiteheads.
Oh, okay. All right, so let's move on then to, I think, what most people think of when they think of a pimple
Yes.
or a zit,
Yeah.
and that is a pustule.
Right. Pustules are red, inflamed bumps with a visible white or yellow center.
Okay.
And these are definitely the ones that people, feel the urge to squeeze.
Yeah, don't do it. That's what I always hear, right? Like, don't squeeze.
Yeah, that's the advice, right?
Yeah.
And for good reason. Because when you squeeze a pustule, you're basically making the skin more vulnerable to infection. You're dramatically increasing the chances of scarring. And you can even spread the bacteria to surrounding skin and end up with more pimples in the area.
Oh, that's so gross.
Yeah. So, you might get that temporary satisfaction, but you're likely to have longer-term problems.
Okay, so what about papules? I feel like this is not a word that I hear as often.
Yeah, papules are also inflamed bumps that are red, swollen, and often tender to the touch.
Okay.
But they don't have that visible head like a pustule. And they form when there's a break in the wall of the hair follicle. And the body sends white blood cells to the area, which causes inflammation.
Okay.
And again, you really don't want to try to squeeze these.
Oh, no.
Because that's just going to worsen the inflammation and definitely lead to scarring.
Got it. Okay, and then I think this is where we start moving into a little bit more severe territory with nodules.
Right. So nodules are larger. They can be quite painful. They're hard lumps that form deep beneath the skin's surface, and they very frequently cause scarring. And they can also lead to something called impaction within the skin, which basically means that the contents of that nodule are kind of trapped in there, and it can make it more likely that you'll have future flare-ups in the same area. And again, like with papules, you don't want to squeeze these.
Yeah, no squeezing.
It can really cause significant trauma to the skin, and then the lesion can persist for weeks or even months longer than it would if you just left it alone.
Okay. And then lastly, we have cysts.
Right, so cysts are similar in appearance to nodules, but they're filled with pus.
Okay.
And they can be extremely painful and also very prone to causing scars. And trying to squeeze a cyst is a really bad idea because you can easily introduce infection deeper into the skin, you can significantly increase inflammation, and it can just lead to a much longer and more complicated healing process. So in these cases, you really want to see a dermatologist.
Okay.
Because they might recommend treatments like cortisone injections directly into the cyst, or they might recommend other steroid treatments to help them heal more quickly and reduce the risk of scarring.
Wow. So there really is a pretty wide range there from what sounds relatively minor to much more severe. So I guess it sounds like, even just being able to identify what type of acne you're dealing with is a really important first step in managing it. Now, the sources also mentioned that sometimes what people think is acne might actually be a different skin condition altogether.
Right, and this is a really important point to highlight. So there are several other skin conditions that can sometimes look a lot like acne. Things like rosacea, various skin allergies, eczema. These can all sometimes present with, bumps and redness that can be mistaken for acne breakouts. And then there are also more severe and less common forms of acne that might not respond to the usual over-the-counter treatments.
Oh, interesting. Okay, so tell me more about that. What kind of things are we talking about there?
Yeah, so there are these, more unusual and severe types of acne like, Peter Fischali, gram-negative folliculitis, acne conglobata. I mean, these are things that, your average person probably hasn't heard of.
Right.
But they often don't respond to, kind of the conventional over-the-counter acne treatments that work for your typical acne vulgaris.
Okay.
And so this is why it's so important that if you're at all uncertain about what's going on with your skin, or if you've been trying those typical acne treatments and you're just not seeing any improvement, you really need to consult with a dermatologist.
Okay.
They can provide an accurate diagnosis and then, develop a treatment plan that's really tailored to your specific condition.
That makes sense. So, don't just assume that it's your standard acne if things are, seem off or aren't getting better with the typical approaches. Okay, so let's dive into some of these like common myths
Yes.
about acne.
This is where it gets really interesting because there are all these beliefs about acne that, can actually really hinder effective management.
Right.
So one of the biggest ones is that excessive washing of your face will help to clear up your skin.
Yeah, I mean, I can see the logic there, right? More washing, less oil.
You would think so, right?
Right.
But it's really not that simple. Overwashing can actually irritate the skin.
Oh, okay.
And when you irritate your skin, you're stripping away its natural moisture barrier.
Right.
And then, ironically, that can trigger your skin to produce even more oil to compensate,
Oh, wow.
which can then lead to more breakouts. So while it's important to cleanse your face regularly, to remove dirt and excess oil, gentle cleansing with, a mild soap or a cleanser that's specifically formulated for acne-prone skin, usually twice a day is plenty.
Okay, that makes sense. What about the whole, the urge to pick or pop pimples? I mean, we kind of touched on this before, but it's, I think something that a lot of people do.
Oh, yeah. It's so tempting.
Yeah, but it's bad.
It is really one of the least helpful things you can do. When you pick or pop a pimple, you're really just making the skin more vulnerable to infection. You're significantly increasing the risk of developing scars. And you can actually spread the bacteria to the surrounding skin, which can lead to, even more pimples in that area.
Right.
So that temporary satisfaction can actually lead to longer-term problems.
All right, so here's one that I think I've heard for years. Acne is just something teenagers go through, and then they'll outgrow it.
And that's, just simply not true. As we've been talking about, adult acne is very common, and a lot of individuals experience their first breakouts in their 30s, 40s, even 50s.
Wow.
And it can be triggered by a variety of factors in adulthood, such as hormonal fluctuations, certain medications, and even those, hereditary factors that we talked about.
Right. Okay, so here's a real classic. The belief that poor hygiene is the root cause of acne. I think a lot of people still kind of subscribe to that idea.
Right, and it's, simply not true. While maintaining good hygiene is important for overall skin health, it's not the primary cause of acne. As we've discussed, the main culprits are, those internal factors like hormonal changes, the buildup of dead skin cells within the pores, and the subsequent clogging of those pores. And then, of course, genetics can play a role. So you can have excellent hygiene and still experience acne.
Okay, so what about the effect of the sun? I feel like I've heard sometimes that, getting some sun or even getting a tan can actually help clear up acne.
So while a small amount of sun exposure might have, kind of a temporary drying effect on the skin, and it could potentially kill some surface bacteria, it's definitely not a recommended treatment for acne.
Okay.
In the long run, excessive sun exposure can actually damage your skin cells. And then when your skin cells are damaged, your skin tries to protect itself by producing more oil.
Oh, wow.
Which ironically can actually worsen breakouts. And then of course there's, all of the well-documented risks of sun damage to the skin in the long term, which far outweigh any potential, short-term benefit you might see.
Right. The age-old question. Diet and acne. Is there really a connection there? A lot of people say, if you eat junk food, you're going to break out.
Right. Well, the short answer is that while, occasionally indulging in those less than healthy food items, it's not likely to, be the sole cause of a major acne flare-up.
Okay.
Unless you have a specific food allergy or sensitivity. Yeah. No specific diet has been scientifically proven to, completely cure or eliminate acne. However, maintaining a generally healthy lifestyle and eating a balanced diet can certainly contribute to overall healthier skin. And it can potentially help manage inflammation in the body, which might have some indirect positive effect on acne.
Okay, so it's more about just, kind of overall wellness rather than avoiding any one particular food.
Exactly.
Okay, good to know.
Yeah.
So this is one that I'm personally happy to hear is a myth.
Okay.
Is acne contagious?
No, absolutely not. Acne is not contagious.
Yeah.
The bacteria involved in the development of acne are naturally residing in the skin, and they're not, transmitted from person to person through contact.
Right.
With it, a contagious infection would be.
Okay, good. All right, what about stress? Because, it certainly feels like stress can make just about anything worse.
Right.
And it seems like, skin is no exception.
Yeah, that's definitely true. And while stress itself doesn't directly cause acne in someone who isn't already prone to it, it can definitely exacerbate existing breakouts.
Okay.
And this is primarily due to the hormonal fluctuations that occur within the body during periods of stress. So while, managing stress is certainly beneficial for overall health and well-being, it's not going to be, the magic bullet for clearing up acne.
Right, right. Okay, and then lastly, I think this is a pretty practical question for a lot of people.
Yeah.
Does shaving cause breakouts?
So no, shaving itself does not cause acne. It's perfectly fine to shave even if you're experiencing a breakout, as long as you take some basic precautions.
Okay.
So make sure that your razor is clean and ideally sterilized. Use a non-comedogenic shaving cream or gel. This will help to minimize the risk of clogging pores. And then just shave carefully and gently around any active acne lesions to avoid irritating them further.
Okay. Well, wow, we debunked a lot of myths there. It's kind of surprising how many of those are still, kind of floating around out there.
Yeah.
So bringing this all together, I mean, what does all of this information that we've talked about today actually mean for you, the listener?
Yeah, I think the key takeaway here is that having a solid understanding of, the true underlying causes of acne, the different ways that it can manifest, and being able to, distinguish those facts from common but inaccurate belief is just absolutely essential for managing acne effectively.
Right.
You can't really address a skin concern effectively if you're operating based on misinformation.
Exactly. So take a moment and think about, what maybe surprised you most in our discussion today. Were you, like many people, mistaken about what causes blackheads? Mm-hmm. Or maybe you weren't aware of just how common adult acne actually is. Mm-hmm. And, think about how those various internal factors we talked about, like your own, hormonal tendencies, genetic predispositions, along with external factors like your stress levels, your current skincare habits, how all of those things might be relevant to your own experiences with your skin.
Yeah. I think it's really about, kind of taking all of this information and applying it to your own individual situation.
Absolutely. And now that you, kind of have a clearer and more informed understanding of, the complexities of acne, what potential steps might you consider taking, moving forward? Could be, reevaluating your current skincare routine, making sure that you're being gentle with your skin, maybe being more mindful of those potential stress triggers in your life. Or perhaps even finally considering, seeking professional advice and guidance from a dermatologist. I think that's, really valuable.
Absolutely. It's definitely worth considering.
Yeah, well, thank you all for taking this deep dive with us today.
Yes. Thanks for listening.